Principles of sports nutrition.
Prevention of sports injuries is based on knowledge of certain etiological factors that contribute to increased injury risk. Etiology relates to the cause or origin of a disease or disorder as determined by medical diagnosis. Risk factors for sports injuries can be grouped into intrinsic, which is subject-related, the individual, and extrinsic factors. These are externally related factors. Intrinsic factors have been identified as individual biological, biochemical, and psychosocial characteristics predisposing a person to the outcome of an injury. So certain individuals are predisposed to specific kinds of injuries based on their individual parameters, strengths, and weaknesses, physically and mentally. Extrinsic risk factors are independent of the injured person and are related to the type of activity during the incident of injury and the manner in which the sport is practiced. Now, joint injuries and muscle tears or strains are very common in the gym. So you've got athletes in the pool, on the field, impact injuries, soccer, lacrosse, football, hockey, and then you've got individuals in the gym where there's no direct contact or physical impact between individuals, but there are injuries that occur inside the joints. There are injuries that are more common than others. Joint injuries and muscle tears and strains that are common in the gym are caused by a number of variables. Number one, poor exercise technique. 2, constant heavy lifting without variation. 3, poor nutrition, which leads to insufficient micronutrient intake. 4, insufficient sleep. 5, drug abuse, including prescription drugs. 6, poor flexibility due to a lack of stretching. 7, training the same body part too frequently. 8, inadequate warm-up, training when you're cold. 9, internal heavy metals and toxicants. Again, this is where the diet kicks in. 10, insufficient antioxidant support. Diet again. 11, overtraining, overreaching, pushing, never ceasing, pushing hard all the time. You're bound to injure, snap, crackle, pop something. 12, acid-dominant diet. Again, diet plays a huge role in the predisposition of injury in the gym. 13, forcing your body to conform to the shape or design of a machine or bar instead of forcing the machine or bar to conform to your body. Remember, we are the Borg, and everything in the gym adapts to us and not the other way around. So many injuries are caused by the simple failure to engage in proper exercise or training technique. Execution fundamentals are frequently ignored or not applied because of just plain ignorance. A qualified, knowledgeable personal trainer, teacher, or mentor is recommended, not only during the initial integration period, but throughout the individual's personal learning curve, as bad habits picked up in the absence of inadequate supervision may inadvertently lead to problems. So, sports injuries can be prevented. Most of them are associated with diet or poor exercise technique and improper warm-up. And of course, if you're an athlete on the field, there are certain kinds of injuries, as in football, lacrosse, hockey, that are almost inevitable. And when you experience these kinds of injuries, go to nature, go to the sports nutrition medicine cabinet, get into natural healing remedies, and learn how effective they are, and learn how to prevent sports injuries that are painful, irritating, and just downright frustrating.